So there was a patient who came to us with a report saying that her sugar values after a diabetic test came high. And I told them that there is a possibility that you have gestational diabetes mellitus and we need to investigate further. And immediately came the denial, saying, Doctor, I've never had diabetes ever. My parents don't have diabetes, and I think this report is wrong. This is not an uncommon situation we have in clinic. So then I thought, let's not go with the propaganda of diabetes and its associations with before. Let's burst some myths around it with obvious scientific facts. I am Dr. Anu Joseph from Trinity Healthcare Clinic, Electronic City, Bangalore, talking to you about myths versus facts on gestational diabetes mellitus. We will call it GDM for short. So what is GDM? What is gestational diabetes mellitus? Let's look into the basics of it. The basics is there is pregnancy, there are hormones that come in to support this pregnancy, and then what happens? In many a pregnancy, nothing further happens, the pregnancy advances as it should. But these hormones can also be slightly notorious when it comes to the basic working of a human body. One such mistake that these hormones can cause is that it doesn't let the insulin work as effectively and efficiently as it should. So then what happens? Insulin is there, the hormones comes and blocks it, and so it cannot go and function on the sugars which are already there in the maternal bloodstream. So the sugars goes increased, and then when we test, we will find that these sugar levels are high, and we diagnose gestational diabetes mellitus. So was this before diabetic that gets converted into this diabetes of pregnancy? No, it came because the hormones of pregnancy came in. So it is not required that the woman should have been diabetic before to be diabetic now. Was it because the mother did something wrong that the diabetic came in? No. The whole problem is from how the hormones work in the maternal body. Now, what can be the trouble if we don't control it? Yes, that is something that we shouldn't do at all. We should listen to the doctors. We should look at the dietary options available. We should look at the exercises and activities that are told so that we can control diabetes. So let's delve into this topic, diabetes mellitus in pregnancy. Before we go into the full video, let me tell you one thing. Consider this video as an educational video and do not use this for medical diagnosis or treatment of any of the medical conditions. Your doctor knows you better. Please take medical advice from your consulting doctor. By the end of this video, you should know about basically 5 topics. 1, we have already discussed. What's the basics, which we have laid a foundation to already. 2, what are the myths versus the scientific facts with which I'm going to burst the myths that many of you might have in your mind. 3, what are the lifestyle changes that you can bring about in your life or in your friend's life or in your relative's life who has been diagnosed with gestational diabetes mellitus. 4, what science tells us about why this happens. And 5, why and when to meet your doctor. So if we can cover all this, we are good to go. So let's now delve into some of the myth versus fact situations. The myth says, once I have gestational diabetes mellitus, I'm always a diabetic. Is that true? Absolutely not. Just like we have already established, it's the hormones that made a woman diabetic. The hormone goes away, the pregnancy delivery happens, the diabetes usually resolves. The myth says the baby will be weak if I eat less. To an extent, a fact. But what is this myth? You don't need to eat less just because you're pregnant with diabetes. We don't ask you to do that. We do ask you for portion control, especially for high sugar diets, for carbohydrates, but we don't ask you to eat less. We don't ask you to eat in such a way the baby will be affected. Myth number 3, and this is very common. I don't have any symptoms. There is no way I can have diabetes mellitus of pregnancy. GDM, for one, is usually never detected unless a test is done. There are almost always zero symptoms, and screening is mostly the only way with which we can diagnose or detect it. Myth number 4, GDM means I will definitely require a cesarean section. Now, this is something that everybody is so scared of, cesarean sections. But let me tell you, a well-controlled diabetic, either on diet, exercise, medications, insulin, whatever, the person when they become full term and there are no other medical indications or obstetric indications that this person should go for a cesarean section, a good number of women do have safe, smooth vaginal deliveries. So, GDM doesn't always mean cesarean sections. Once now we have established these facts versus the myths that you might have in your mind, let's see what science says. Science simply says this much. There are a few hormones that pregnancy leads on to a woman to have. The hormones can block insulin. It can hence cause sugar levels to go up. The science also says if you control a good amount of your lifestyle with portion control diet, probably eating less caloric, less carbohydrate diet, monitoring your sugars effectively, adding on exercise, which I prefer to be post each meal at least 15 minutes of brisk walk or anything else that you can add on to, or use medications or use insulins when needed, with a good monitoring of the baby, its growth, the water levels, the blood flows to it, can actually take a pregnancy to 9 months without much of serious implications and have a safe delivery. Anything beyond this should be considered a myth and probably needs a discussion with your doctor. And I think with all these discussions, we have come to establish that fact. Gestational diabetes mellitus can occur to any pregnant woman, but yes, a few higher risk factors. Women above 30 are slightly at higher risk. Women who have had a previous baby which is above 4 kilos or even 3.5 kilos in Indian scenario are at higher risk of diabetes in the next pregnancy. Family history of diabetes put you at higher risk. Women who are already obese or overweight before their pregnancy is at higher risk. And there are certain women who have been on certain medications for other medical issues who also may get into become diabetic in pregnancy. They need to be more alert about it. They need to be thinking about their health, lifestyle choices way before pregnancy begins and continue to think about it during the entire pregnancy. So I hope with this video we have burst lots of myth and now you are equipped with the scientific facts that will help you allay all anxiety in your pregnancy if ever you have been diagnosed with GDM in pregnancy. Last but never the least, you should know that there is a concept of emotional well-being. Pregnancy itself in today's world is becoming a stressful experience for many couples, and a diagnosis of GDM is going to make sure that that stress level goes up. Now, the issue is stress makes your diabetes go bad. So, what you should do? You should allay your anxiety, talk to your doctor, get into being in a better lifestyle, and make sure that you understand that GDM is not your fault. It is not something that you should think that you have made happen. You should just worry about how to go forward with it, how to make your lifestyle better, how to monitor yourself better, and have a much smoother journey of pregnancy. And in between all this, if you find these things happening to you, make sure that you see your doctor. Now, what are those? If you see that there are symptoms of any infection, if you see that you're becoming suddenly very thirsty, you're passing too much of urine, if you see that the baby's movements are reduced, if you feel sudden onset of fatigue or feeling low, I think you should definitely meet your doctor and discuss. And of course, when you've been asked to monitor your sugars at home and your sugar levels are way high, don't wait for your next appointment. Make sure that you reach out to the doctor as early as possible. So if you can keep these in your mind, you're good to go. And yes, friends, if you really liked this video, make sure that you like, share and subscribe to the video. If you have any questions or comments, please write to us in the comment section. If you need any other informational videos, please ask for us in the comments. We will make sure that we will include them in our future videos. So signing off for today, Dr. Anu Joseph from Trinity Healthcare Clinic, Electronic City.